Hey everyone. It's nice to see you all trickling in from the waiting room here and getting audio connected. Good to see so many of you here tonight. This is wonderful. We've made it to 7:02 already, so let's go ahead and get started. Welcome to today's event for students who have been admitted to the Population and Health Sciences Online MPH program. My name is Lisa Garber. I use she, her pronouns, and I'm the academic program manager for the online degree program. I work really closely with students on program planning and accessing services and resources across the U. And over the past 2 years, I think a lot of us have become pretty comfortable with Zoom, but if you have any questions or concerns about the functionality, please go down to the little chat icon at the bottom of your screen and message us so that our team can offer some support. We've got a whole crew on standby here to help you out if you have any trouble hearing us or engaging with us over Zoom in the next hour or so. I'd like to invite everybody to take a moment to introduce yourselves in the chat box, share where you're logging in from, and maybe a little bit about your educational or work background, whatever you feel like sharing. When you're in chat, make sure that the recipients box shows everyone so we can all get to know each other. Otherwise, it's just going to come to me and a couple of our co-hosts here, which is wonderful. I want to get to know each and every one of you, but none of your peers will see it. So while you all take a moment to do that in the chat box, I'd like to also ask our panelists to introduce themselves. We're going to have about an hour planned to chat with them. And when our hour is up, I'll invite anybody who wishes to stick around for further questions and casual conversation to do so. But at 8 p.m., if you've got a jet, feel free to log off. Dr. Cardia, would you start us off and introduce yourself?
Absolutely. I'm Sharon Cardia. I'm the Associate Dean of Education here at the School of Public Health. I'm also the director of the online program and professor of epidemiology. It's a great time to be in public health, so welcome.
Thank you, Sharon. Emily, are you ready to go next?
Hi, I'm Emily Silver. I use she, her pronouns. I'm in the getting towards the end of my first year in the Population Health Sciences program. I am outside of school. I'm a lactation consultant working in private practice in the Metro Detroit area.
Thanks, Emily. Liz, are you ready?
Hey everyone, my name is Liz Baldwin. Just like Emily said, I'm almost at the end of my first year after I aced Dr. Cardia's class, hopefully. And so beside classes, I work as a quality analyst at LabCorp. I got my undergraduate in biology, and so I went straight from that into the lab world. And I'm looking to obviously change that into public health. I love cooking and baking, and I have 3 cats, and I'm excited to get to know you guys.
Wonderful, thank you. And Lyric?
My name is Lyric. I'm residing in Ann Arbor, Michigan, actually, but part of the online program to allow me to continue working full time. I was actually graduated from the undergrad school of public health as well at Michigan as part of the inaugural cohort for that program. Spent a year in development and fundraising for Michigan Medicine, and then due to COVID reasons, lost that job, got a new job that I'm currently in research with the psychiatry department. And I actually just accepted a new offer at Drexel University. So I'll be moving to Philly this summer. Really looking forward to that project manager role. But in terms of the online program, I'm in my 2nd year, graduating in a couple of weeks here. So pretty excited about that.
Congratulations, Lyric. I didn't know about the new gig. That's exciting.
Thank you. Yeah, just found out last weekend while I was in Philadelphia, actually. It was kind of cool.
Oh, nice. Well, thank you all. Wonderful introductions. We'll chat quite a bit more in a minute. I recognize that our leadership has already shared quite a bit of information during the school-wide admitted student programming and videos over the last few weeks. And then many of you have seen our webinars and a lot of recordings are available. So today we're really going to just focus on the details that you might not learn elsewhere. I'm going to cover just a quick rundown of some of the most frequently asked questions on some slides, and then we'll dive into conversing directly with panelists. So we are still in the middle of our admission season for fall 2022, and we have about 20 or so admitted students here for this event, which is wonderful. We're getting our cohort up and running over the next couple of months. We're going to know a lot more about the incoming cohort after our application closes in May, but you will be joining a student body of more than 1,300 students across the School of Public Health, which means great opportunities for networking with peers and a huge alumni base. And we currently have 124 active students studying population and health sciences online. This will be our fourth Pop Health cohort. Our first cohort of 28 students started in 2019 and graduated just last year. Our second cohort of 40, including Lyric, is getting ready to graduate next month. And then we have 80 or so students in our third cohort as well. So as you might imagine from panelist introductions and the introductions you're seeing in the chat box from your peers that can be joining the 2022 cohort, our students have a really broad range of experiences and career aspirations. Some students started right out of undergrad, some are already working in a health-related field, some are changing careers midstream, and some are getting ready to pursue sunset careers. Next big question is usually around the resources available to you as University of Michigan School of Public Health students. We consistently earn top rankings for the programs and resources we offer, and as online learners, you gain access to all of it. You're taught by the same top-notch faculty that conduct their research here and teach in the residential classes. You'll be supported by our Office for Student Engagement and Practice, or OSEP, which is a team focusing on quality student life, enriching practice experiences, and successful career preparation and outcomes. I'm your main contact on the OSEP team, and I aim to connect you with the right resources at the right time. So that starts with, even before classes begin, I'll be sure to tell you how to get your student ID, how to make an appointment with the SPH Writing Lab, how to use library resources, access journal articles, how to get help from our terrific librarians when you're looking for the right reference material, all things that you'll need to succeed in class. And throughout the program, I'll remind you to take advantage of lots of things that happen throughout the academic year, like virtual events and activities that will help you advance your career, things that are coming out of the experts in our careers and alumni engagement teams. They do a lot of events that focus on career exploration, readiness, job search, mentoring, networking, all key topics in your job advancement and searches. And I'll also be working to promote health and wellness by sharing virtual well-being resources and activities for stress relief, exercise, nutrition, mental wellness. These things are all supported by units across campus and within the School of Public Health, such as CAPS, which is Counseling and Psychological Services, the University Health Services, Healthy, and many, many other units across the university. So one of the main ways I share this information is on Coursera, where we take our classes. You'll actually be invited to an onboarding and advising course this summer. You'll see that invitation coming from Coursera as early as June. And you get to go through this self-paced course that helps you get started as a student in the program and become familiar with the Coursera platform so that you know the ins and outs of it before your courses even begin. The onboarding course will help you get to know the university policies and procedures, including instructions for registering for your classes, but it'll also be a resource to you throughout your studies. You can learn about the main university resources available to you right here in Coursera, and then you can revisit it anytime. And then Dr. Cardia and I also host monthly group meetings on Zoom. So during these meetings, we'll talk about how things are going and what could be most helpful to you based on where you're at in the program or what you're experiencing right at that moment. You don't need to wait for the next regularly scheduled meeting to connect with us though. You can schedule one-on-one meetings anytime. So you've probably all seen a link in my signature, my email signature, where you can just hop right on my calendar, or you can always shoot Dr. Cardia an email to set up a meeting with her too. Or you can turn to Slack. So once you matriculate in the program and go through onboarding, you'll have access to our Slack workspace. And this is my #1 choice for sharing new content that I want you to know about and for chatting during office hours. I regularly post tips and resources here, but most importantly, so do the current students. So other Pop Health students are often the best source of information and support for your peers. Our program workspace is a really great place to ask for help or ideas, to create study groups, to socialize, and to strengthen your academic and professional networks. And you'll learn about it, how to use it, and gain access during onboarding and advising this summer. So that's just kind of a quick rundown of the most frequently asked questions to set the stage for how you're going to get oriented to this program. But at this time, I'd really like to shift attention to our panelists in more of a meeting style. So I'm going to go ahead and stop sharing my screen, make sure I can see our chat box here, and pay attention to any questions that you all have in the chat box. And ask our panelists to take over. So Dr. Cardia, I'm going to put you on the hot seat first.
Okay.
Could you start off with just telling us a little bit about your thoughts on this moment in time for the field of public health and population health?
Oh, that's a pretty big question. So, I mean, I think all of us have a new appreciation for public health given this pandemic, and not just perhaps the ways that we may have thought about it before. And I think for many people, when they first thought of public health, they were thinking more about, like, the classic that we get is fluoridation of water and, vaccinations, but it's a ton more these days if you think about all the ways in which we could have done better with the pandemic, whether or not it would have been better health ed, whether or not it would have been better sort of communications, and even having better data systems so that you could really figure out what was going on. It was a bit of the Wild West for a while. And what we've, I think, been also able to do right now is try to move a little bit away from the coronavirus to the big things that are also on the radar for public health, like climate change, extreme weather events, that are influencing air, water, health outcomes. But, that's not all, because there's also sort of major social determinants of health, racism as a public health issue, or for instance, you could think about sustainability as one of the things that public health really has to start thinking through. So there is just a ton of work to be done by people in the field of public health, from basically on the ground to, policy making and advocacy. So there's just a ton of work in public health these days.
Thanks, Sharon. I'm going to keep going with questions for you here. I've got a number of them prepared for you and for the panelists, but I also want to invite all of our current, admitted students who are in attendance today. Feel free to type a question into the chat box or unmute your microphone and speak up. Welcome anytime. To keep things moving, Sharon, I'm going to ask you to tell us a little bit about the Pop Health learning experience and community.
I mean, the population health learning community has always struck me as ironic that I feel like it actually is much closer, tighter, and well networked than the residential. That there are ways in which, the sort of supports like Slack or the monthly advising sessions, or even actually the way in which we do the Zoom sessions that have the faculty typically going over some of the material, but then moving into breakout rooms. We tend to know each other a lot faster and a lot, I'm going to say, more deeply in terms of like what people's background and specialties are, or what they have previous experience with. And it just seems to be a quicker route to, I'm going to say, a more pleasurable learning experience where we're learning from each other as well as from the faculty and the material that hopefully is taking you into some of these areas of public health I was talking about earlier. I prefer it as a teaching modality than the residential. Don't tell the residential, that, but I have a much better time with the working professionals that we've lucky to get into the program. It's a lot more game on kind of teaching for me.
What do you think, students? Liz, unmuted. Go ahead.
I was just going to say, it's okay for you to admit that we're the best.
You're a lot more fun.
It's a good group to work with, definitely.
Well, the ability to bring real things in makes a big difference. Sorry, Lyric.
No, you're fine. I was just going to echo the sentiment that I think that our cohort has grown much closer than I would have expected, coming into the program in an online setting. And I think that is largely due to the group work and the way that people kind of break out into their own certificate tracks. I think that's a really cool part of the program. Because then you end up taking, 3 or 4 classes in a row for 6 months with the same 10 to 12 people. And you get to know each other pretty well. So I've really enjoyed that aspect of it. Definitely.
Yeah, absolutely. I know, Lyric, you're in the second year, but with being in the first year, I feel like I already know a lot of my cohort, including Emily. And the fact that I feel like we work really well together, and I feel like there's that support system. There was one time in one of my particularly harder classes that I expressed on Slack that I was having a hard week, and I had several people reach out to me with really nice messages and support, and everyone is just kind of in the same boat, and everyone is really collaborative and awesome and has great ideas. And yeah, it's a great learning space, more than I expected.
Is this a good time to talk about Coursera and what we like about or should we wait?
You can hop to Coursera if you want.
Just in terms of
filling out the feedback survey about our learning platforms, that might be a different story.
No, it's good things. It's good just to say that for the learning style, for having kind of a mix of asynchronous and synchronous learning, I feel like I'm just kind of getting used to all that Coursera has to offer with the weekly readers. So there's a transcript, like one long transcript of all the modules and lectures for the whole week for every class. And you can really take notes on that and highlight and watch the lectures at the same time and go back and forth. And it's a really interesting, rich way to learn. I think that's totally different from a live lecture where you kind of have to be awake and present and you get it and then it's over. But having everything online makes it so that you can go back and go over it and read your notes over and over again, your notes from what the instructor is actually saying, like their exact words. So.
Good reflection. Thank you. So there are a couple questions in the chat box. I know we'll chat some things, we'll verbalize some things, and we'll just try to get everybody's questions answered as we go. But some questions around, absorbing class content with the shorter terms and having longer versus having a full semester. So Sharon, do you want to talk a little bit about how the classes are set up, and then we'll have students tell you about how it feels?
So we actually are in transition to a little bit more elongated. It's still short. So a typical semester in the residential program is in the 15 to 16 week space. And what Liz, Emily, and Lyric have encountered are 6 and 4 week classes that are 3 and 2 credit long. we've learned kind of the hard way that one course will sort of smash into the next, and there will be this kind of, I'll call it difficulty, basically letting go of the assignments or the pieces that are needed to finish one class to start another. So we are transitioning to a schedule that is 7 weeks of the class and 1 week for basically either a final or to finish up that project that you have in that class. So all classes will be 8 weeks inclusive, so that it's a little less of a jam at these intersections. It's still relatively fast paced. And we recognize that. That's why we have only, basically 2 as a max number of courses. The only exception to that is in the second year when we've got the applied practice or the integrated learning, which is much more self-paced. It's not a class per se, but I'll leave some of that discussion of those for a little bit later on in the program.
Thank you. Any of our current students want to chime in on how it feels to go through some of the accelerated courses, knowing that the students coming behind you get a little extra time in there?
Yeah, I was going to say that I really like the format because to me, I was used to an undergrad taking several classes at a time. And, sometimes being like, wow, I really need to focus on organic chemistry this week, even though I also have a final in genetics. Like, there's just a lot going on. And so I feel like with this, even if they're accelerated, I get to put all of my brain power into one subject, and every amount of studying that I'm doing is for the same class, it's for the same assignments. And so I actually really prefer it. It's made my life way happier, and I don't feel like they're too fast. I feel like they usually are well balanced, that I don't feel like I get overwhelmed super easily.
Yeah, I kind of tie this. I saw someone asked a question about the certificate tracks too. Something I found I've focused on. So I guess if we're going to talk about it more later, I won't go too into depth on the certificate tracks. But there's basically, you can earn a certificate. You can earn up to 2 certificates, I guess, in basically any of the school public health departments. So there's health, behavior, health education, nutrition, right, and epidemiology, environmental health. I'm probably missing 1 or 2. I was
Biostatistics.
Thank you. Yes. And I was in the health, behavior, health education certificate track for the first series of electives. And what I find, and I agree with Liz about, benefiting from being able to focus on like 1 or 2 classes or subjects at a time and get, really into the weeds on them, even if it is a short amount of time. But the certificates, the tracks, the classes that you take in those tracks really build off of each other, I find. And, I found myself, I'd be like 3 classes deep into the certificate, and then I'd be like, oh, the first 2 classes are always like, a lot of it's review. And so it's like kind of reinforcing a lot of the things that I've learned. And then I'm able to go back to prior classes in Coursera and remind myself in the videos, oh, yeah, I did learn about that theory, or yeah, I've done a logic model before. So I think that's been really helpful in absorbing the content.
Thank you. So you touched on this really briefly for a second, Sharon. Do you want to talk a little bit about the experiential learning components of this?
Sure. So in the second year, we have 2 semester-long courses that are really actually much more sort of self-paced and are working to, in the fall semester, that first course is in the applied practice experience, where we ask you to either pull from your work domain, your career, I'll call it aspirations, and to create or co-create, I should say, a project with an agency, an organization, your workplace. If you need help finding an organization to work with, I'm happy to do that. We have a nice practice office that we can do outreach with. We have the benefit in an online program to actually touch into agencies and organizations all over the nation. And we've even had some students that have worked internationally to do projects, and they're typically smallish projects. It's making an infographic, it's developing a survey, it's doing some data analysis, or we've had some people do market scans or write up kind of evaluations of trainings that an agency or a community organization has done. So it's working with an external partner. And the expectation is that you'll do 2 of these, smallish projects. That is one of the springboards for many people into their integrated learning experience, which is in the last semester, where you're pulling together, I'll call it the didactic, the course materials with a public health issue or problem. And we ask you to pick from one of several public health genres, policy briefs and studies, program plans or program evaluations, grants, brief reports. And what we see over time is that people who have, for instance, jobs where this is a great way for them to sort of break out a little bit, maybe get some experience that would demonstrate how they're set up for a promotion once they get the MPH is one stream. And for others, it's actually a launching pad to take them into a different career stream altogether. We just had a student in the who's a second-year student who was basically teaching middle school, and just a month ago changed, quit and got a job at a local public health doing an evaluation of that local Department of Health response to COVID. So she's now using that as her integrated learning experience. Right. So we are just fine with having the interaction with your kind of work and your aspirations come into that experiential layer where you're not really learning content, you're really applying it.
Thanks, Sharon. Lyric, how did your Apex go?
Well, I was thinking about responding to Gabby's comment in the chat, actually, kind of
okay. Go ahead.
Related to Apex.
Yeah.
Because she asked about the extracurricular opportunity. And so a professor coincidentally connected me with Public Health Awakened back in like April of last year, maybe February even. And I was volunteering with them, for a couple of months, did a project with them over the summer, and I was able to use that project as my Apex project. So I was able to sort of build off of that relationship that I had built, which was really cool. I really enjoyed that experience, and then having to sort of dissect it and reflect on it a little bit, and think about what went well and what could have been different. So I don't know. I really enjoyed that, and I've also just really enjoyed generally the freedom to, in all of the classes and most of my assignments, like choose the subject, and just apply the principles and the theories that we're learning about to any field that I want, and kind of carry that through in all of the projects and classes, including the Apex and the IOE. So.
Thank you. So some questions around how, how classes are structured. Let's see, Michael, I'll get to that in 1 second. Yep. How classes are structured. What's it feel like to go through a class? Maybe what's a typical work week look like for you? And are you working in a lot of group projects or individual? Liz, you want to
I can speak to that if you want.
That'd be great.
So I'm just going to also combine this about like how this fits into a full-time job. Because I remember that when I was first coming into this program, I was really concerned about not having a life at all. And I would not say that that's true. I would say that you got to get creative with your time, but I still have time to have fun and, you know, do some other hobbies as well. I would say that majority of the projects are individual, although I do have some group, I have had some group projects, but a lot of them have been individual. And the impression I get from some of the classes is that changes depending on how well that goes for a year. But in general, it's individual. And I was just going to say that, like, a tip I had for people as far as juggling the work life and the student life is that sometimes if I don't feel like I need to see those particular slides right away, I'll listen to a video on my way to work or on my way home from work. And then later I'll review like the PowerPoint slides if I need more information on some of that. And, just getting creative is really where I find that extra time, and it's really not so bad. I promise.
The other nice thing is being able to see as soon as you, I think it's a week before your class, before each class begins, you get access to the whole class, all the class content in Coursera. So you can kind of look. So usually what I do is as soon as the class opens on Coursera, I'll just get out my planner. I still have a paper planner and I write in all my due dates because there's a tab that just says grades and it's all the graded assignments. And I just write in when everything's due. And then you can really look like, do I have a birthday party that I need to go to? Is my kid going to be on spring break? Whatever, you can kind of plan your life around what's due, and that, that helps a lot. And then I'll also admit that, you can watch the videos on 1.25 or 1.5 speed if you need to kind of get the content, but you need to save time.
Wonderful. Just catching up on some of our chat questions here. I think it's a good time to talk a little bit about what some of the things that really make this program so unique. So Lyric, it's been 2 years for you. Emily and Liz, just 1 year ago, you were making this decision. What really sets this program apart from some of the others that maybe you were considering at this time?
Well, I can say that the condensed nature of the semesters and the online format was the primary factor for me, because I knew I was going to want to continue working full time. And the one live lecture per class a week on a given evening at 7 p.m. is usually pretty doable for most people, I've found, at least in our cohort. I think I've only actually missed one class so far the entire program, and it was this past Monday's class because our car broke down in Ohio and I didn't have my laptop. So kind of a bummer. But other than that, been pretty good about attendance. But I guess that was probably my major factor in terms of like deciding on a program, and the familiarity with the school and the administration and stuff.
I actually, I applied to a few different programs and I accepted another offer before I accepted at Michigan until I met with Lisa, kind of like at the last minute, because I just had this nagging, I went to Michigan for my undergrad. And so it's always hard, you never think you're going to say no to Michigan. But I just had this nagging feeling like I need to do more. I need to look into this program more because I'm so committed to maternal child health. I know, that's my life path. And there were some other programs that I applied to that had a specific whole program around maternal child health. And after talking with Lisa and learning about all of the supports for students and how this program, it's a fully fleshed out online program. And I think when I compared it to other schools, their remote offerings were kind of more of an afterthought. Like you might be in a cohort with just a couple other people, and you might never meet anybody on Zoom or have any one-on-one time with anybody. You're just kind of like watching pre-recorded lectures and submitting assignments. And so the fact that you're getting all the benefits of, kind of just being at Michigan, except you're in your house. I think it just really set this program apart in my mind. And I'm so glad. I'm like grateful every single day that I scheduled that meeting and made this decision.
Yeah, I was going to say from my experience that similar to what Emily said about the concentrations that are available through this program, I feel like if you look at several other online programs, they only have one or two options that you can concentrate in. At least that was my experience with the schools that I looked for. And in particular, I was interested from the beginning in nutrition. And so the fact that, Michigan has such a strong nutrition program and strong public health department. I mean, they're in the top 10 according to US News. And also they're half the price of a lot of these other schools that aren't even as good. And so all of that together, I'm like, lots of options, great school, great nutrition program. It's half the price. Like, it just all worked out for me. And I've had a great experience. Long story, but I applied late and I was still able to join this cohort. And it's really just been a great experience since. And I 100% say that all of you should become Wolverines.
No pressure. Thanks. So, would any of you like to comment on some of your favorite projects that you've done so far? Exciting activities that you've had in class or projects that you've loved? Things that really stuck with you?
Okay, I'll go, then you go. In the nutrition, the kind of intro nutrition class that we took in our first semester, we had to come up with a program, like design a program from scratch to address a nutrition related health disparity. And it was very in depth. There were a lot of layers to it. There was a lot of applying concepts that we had learned in other classes. And I thought that was so fun to just really kind of imagine that we could just develop this program kind of from start to finish, including the evaluation and everything. Yeah, that was a good one.
It's a good course. Larry, did you have an idea?
Yeah, I guess the one that really sticks out to me was the Ohio Opioid Epidemic simulation class that Sharon runs. I think it was the first class that we had with Sharon in that first year. And that was really cool because the Yellow Dig platform is cool. Basically, the assignment was everybody in the cohort took on an alias as a representative for a local organization in Ohio, or just like an individual sort of community leader, lawmaker, whatever it was. So all the different stakeholders that have a role to play in addressing the opioid crisis. And there were photos attached. We were basically just role playing as different people for different organizations in developing a response in a given area. We had to find our own we had to build our own coalition with classmates based on what they did and what we did and where they were located. And it was very real life kind of simulation that I found pretty cool. And I guess just in general, I think I've really appreciated the ability to all of the assignments that I've had have been really applicable. I think in undergrad, it was always write a research paper. It's well, okay, fine, I'll write a research paper again, as I've done for every class ever. But in this program, it hasn't been that. It's been write a policy brief. It's been develop a fact sheet. It's do this simulation, write a grant proposal. So it's all these different sort of mediums of conveying public health information or creating public health programs that I find really helpful in building a portfolio and getting real practice. I can pretty confidently say that those assignments helped me get the job that I just accepted. Like if I didn't have that experience, I wouldn't have had the qualifications necessary. So that's been awesome.
I love hearing that. Let's go ahead.
You're good. I just wanted to throw in there that if anyone's coming in with a particular goal in mind, so I started knowing I was going to go into the nutrition track. I've tried to take all of my classes in the first year that are like communication, their policy, their, population health, everything, and apply it in some way to nutrition, just so that way it's a skill builder for things that you're passionate about. And I feel like that's a way for you to enjoy every single project you do because you're passionate about it. And then it's also, like Lyric was saying, it's a great skill builder for future job searches.
That's a great segue into how this all applies to your professional goals. Are you using what you're learning in class at work, setting yourself up for the next step? What's that look like?
I would say I can't think of any specific examples in my current role. Nothing's coming to mind, but I know that I've used things because I've distinctly had the feeling of like, oh, wow, I just learned about this and I can use this right now. I can't give you any specific examples. But in terms of the reference I just made to this job, I remember in the first interview I had with the principal investigator, he asked me if I've ever done any like qualitative data analysis. And in my job, no, I'm a recruiter. I mostly just talk to patients and try to get them to join the study or take the survey. So not a lot of data analysis experience, but I had an implementation science class where we had a big project and assignment on qualitative coding and interview for themes and sort of finding, like it was exactly what he was asking. And I was able to give that example. Like I said, I don't do it in my job, but 2 months ago I had a class and I learned about the, principles of, coding data and qualitative analysis, and I practiced it. And that was like the one question he asked me where if I hadn't had this class, I would have had no answer. So that one was good.
Thanks. I'm glad you had that.
On a kind of strange note, so in my job, I'm a quality analyst, like I said previously. And so my last class, Environmental Health Sciences Introduction, they talked a lot about root cause analysis and other things like that I actually do all the time for my job, not related to health sciences. And also I share an office with our EHS officer at the LabCorp location. And so I told him, first of all, obviously I'm learning about this, so I'm super cool, just like you. But it's also helped me as quality to work better with safety and be able to identify some things in a way that I just didn't really know that information before and understand where he's coming from. And I think it's just helped us work well together, even though I don't do safety as my job.
Nice, thanks. Sharon, what are some of the aha moments you've seen? You've been with us since the inception of this program and seen students go through every stage, start to finish, where they get a seed of knowledge, apply it to work right away, or make that type of connection at work where they're building bridges and working better with their peers. What have you seen?
I mean, I've seen a ton of things like there was one time in the first cohort where somebody had, this was actually a physician who was taking the courses in order to kind of get a second career because they were transitioning out of their clinical practice. And all of a sudden, with the tools of biostatistics and epidemiology, they could start to use the national surveillance data sets that we go over and actually answer questions that he's been dying to know, like, did the Affordable Care Act and the emphasis on population health change screening practices? the Behavioral Risk Factor Surveillance Survey and then Haynes has that kind of data where they ask people. So he's just started to go in and use this data and start to write papers and commentaries. And so it was one of these kind of like, now you have the power and the tools and the access. Now you can kind of go in and start to do this work. I think another one that was a real eye-opener for me was just how quickly people would be asked to apply what they know. So we had one woman who was in the military who transitioned to a civilian job in Alaska. And basically her first week, she was in the applied practice experience class in the fall. And she's like, they've just asked me to do a community health needs assessment. And it's like, here we go. And she had just learned it, in my class in the end of the winter semester. So she just dug in and did one. So there is this way in which it really, you can take what we have and apply it pretty quickly. It's been wonderful to work, I think, as I said earlier, with people who do have the capacity to translate it into action almost immediately.
One of the very, very exciting things about this cohort. We hear really consistently that everybody learns from each other too, since there are people in Alaska writing community health needs assessments in rural populations, and then there's physical therapists here and development officers, and people in every different kind of professional field bringing their experiences to the classroom. You can really learn from each other, and that's kind of an exciting thing to watch, at least from where I sit. I think it's great.
We've also had some people who have taken this experience and decided to go either into medicine or into PhD programs. Mm-hmm. So that is also happening, and at a way that I didn't actually expect, because many people think of the Masters of Public Health as kind of the professional terminal degree, of which you may add it to a portfolio, or it may be your singular, but to use it as that stepping stone makes a lot of sense for people as well, but it just wasn't something I had anticipated.
What other questions do attendees have today? Anything burning that we haven't yet gotten to? Feel free to type it in chat. If we've missed it, feel free to copy paste again or unmute your mic and let us know what's on your minds.
I do see the questions about doing research projects with faculty, both in the school or in other schools or departments. We've seen that every single year, but it tends to be one of these like meetups where there's I'll call it a cold call or email or something that sort of says, hey, I'm really interested in your work, Professor X, and I am in the online program working remotely. Is there any way to do research with you? And surprisingly, if you do a pretty good job of just that sort of intro, I mean, many faculty are, we've all been working remotely for a long time now. So that's not a barrier that it used to be, I think, 3 or 4 years ago, kind of psychologically. Now it's like, oh yeah, sure. So we have had that for every single cohort. It's a matter of, you do have to do the legwork as a student. This is the way it's always been, residential or online.
Yeah, I'm glad you brought that up. Thanks. What other exciting opportunities have you experienced at School of Public Health, things that you can take advantage of by being a part of the School of Public Health community?
One thing I didn't really have on my radar, but just kind of was trying to jump at every opportunity. And, my first couple of weeks as a student was the Student Alumni Mentorship Program through the School of Public Health. And that's kind of one of the known benefits of, being a Wolverine, is the deep alumni network. So I signed up for that, and it's been running all year long. I was paired up with a mentor who she actually completed her program, I think 2 or 3 years ago. So she's pretty fresh out, and she's been able to give me this amazing perspective on the job market, interviews. What is it like being, being in a, she's got a lot of responsibility kind of as a fresh grad. Like, what does it feel like in her work? And then she's also matched me every single month. She's kind of put me in touch with another person who, who's out there working in public health, in maternal child health. So she's been able to get me informational interviews with people in nonprofits, public health departments, kind of like every sector of public health you can think of, to help me kind of narrow down my job search in the future. So that's something I really, really strongly recommend, is just finding those opportunities to plug in and connect and feel like you really are part of the university.
Thank you.
That's great, Emily.
I'm a huge fan of that program. I think that that's just one of the strongest things. Like you said, Emily, the deep Wolverine network is just wonderful to take advantage of. Any other key resources, tips for students who will be starting in the fall, things that you have to take advantage of? Or tips for students who are trying to make their decision? What should we be thinking about as we're heading into April 15 decision deadlines and trying to think through where to go to grad school?
I guess in terms of something else to take advantage of, it's kind of been alluded to already, but just like really making an effort to connect with the people in the cohort. I think that I found it really cool to work with and work closely alongside people who are like, I'm 24, I haven't really been in the workforce very long, but I'm, working in class with Dr. Rob Davidson, who's like on CNN while he's in our program, like, speaking about COVID-19, and just like people who are really out there already kind of doing the stuff and learning from them, and being able to like give your perspective to them too. Because as someone who is fresh out of undergrad and still kind of like learning, you have these new set of eyes that you can put on other classmates' projects. And I don't know, I think that sort of back and forth has been really valuable.
Nice, thank you. Oh, Liz,
I was going to say similarly, Lyric, I feel like that's true with the faculty as well. I don't know if it's because everyone's hanging out in their houses on Zoom, so everyone's more chill, but I feel like I've been able to have, conversations in class with professors that just feel really personable, and you don't feel like, wow, there's some like, amazing PhD. Like, of course they are, but at the same time, I feel like they come down on your level a bit, and there's really that conversation where they are just as interested to hear what you have to say as you're interested in them teaching you. And it doesn't feel like a lecture, like, ever, I don't think.
I'll just say, like, come in with an open mind, know that whatever you feel like you want to do in public health, you can do with this education, and be open to being surprised that you might, because you get that broad education in the first year, you might end up falling in love with something that you didn't even know was your skill set or your interest. And then you can really choose those certificates to enhance the education.
I think we have a final question in the chat box, a little bit about advice on funding.
I'm coming in. So I think, like I said before, that this is a pretty good price program as far as MPHs go. I think if you look across the board, they're $70,000, $80,000, which is getting up to MBA level there. But And so I think that this, as far as MPHs go, this is really affordable. I would say that there's a couple different options. Of course, you can apply for financial aid and receive a loan. But at the same time, if you feel like because you are working and you have some of that money, that they do a payment plan as well that you can sign up for that gives you 4 to 5 months. I think it's 5 months actually, but they take your semester price, they cut it in 5, and then each month you pay it off. I did that for the first semester and that worked really well. In the second semester, I did take out a loan, but I'm doing the same practice of like paying a certain amount every month as the same idea as the payment plan. It just gives me for flexibility in case, you know, something bad happens. But I think that they're just, that flexibility is there. And I think Michigan tries to do that. And of course, there's always, if you have the time and the amazing, you know, amazingness of yourself, you can apply for really cool grants and scholarships. I just usually am lazy about that. So that's just from my side of things, is since you can work full-time in this program, which is one of the reasons I picked this program, to me, you can at least afford to make some payments as you go. So it's not just one giant sum at the end.
Thanks for that, Liz. That's helpful. Sharon?
We've also had a number of students who kind of knew from the get-go that, okay, I'd love to be able to do it in the 2 years, but both financially or for work and family reasons, I'm going to take 3, right? And they just sort of from the from the beginning say, we're going to spread this out so it's a little bit less of a stress.
Mm-hmm.
And there we would just ask you to work with Lisa and I to make sure you get the right courses and the right, you know, order so that you don't have accidentally 3.5 years or whatever it is. And this is particularly important for people that have got occupations. For instance, we've every year we've had a few people within the military where if you're deployed, right? I mean, you don't have a choice. So for us to be able to be flexible and allow them to take incompletes, you know, complete it in 6 months or whatever it is, we tend to work with people to the best of our abilities to make, you know, to make it work. So.
Good tip, Sharon. Thank you. I recognize that we're right at 8 o'clock. And so I want to thank everyone for their time today. Thank you, panelists. Thank you, students. Thank you, attendees, for joining us tonight. I'm going to stay on here. If anybody wants to linger and chat further, I'll be around for a little bit and just kind of keep that door open. If you have to jet, that's fine. Thank you so much. We'll share the recording in probably just a couple of days here, and hopefully keep in touch with you over the next few weeks as you all make your decisions and get ready to start in the fall.
Thank you.
Thanks, everyone.
I was just going to hang back for a moment. I've already committed. I really love everything that this program has to offer. The one thing that I was just a little confused about when trying to read and get a better understanding of is the Capstone Projects.
Mm-hmm. So we don't have what would be considered like a single capstone project that people have to do. What we have is basically this integrated learning experience where we've tried to pick the typical things that somebody within public health might do as a part of their job, and ask you to pick one of those, I'm calling them genres, because policy briefs and policy studies are one thing very different from like doing a data analysis and writing up a brief report that might be in the style of the CDC's Morbidity and Mortality Weekly Report. Or even doing, for instance, we've had somebody doing a scoping literature review, something that is really looking to give an in-depth view of an arena. You know, this semester we have somebody who's doing that around the influence of disabilities and mobility, and which is a big issue within urban areas. So it could be anything in the genres, and you are allowed to pick that topic. And faculty or lecturers or people that are attuned to working in these different genres are helping you along the way. And I brought up the lectures because we've been lucky to get some colleagues from the Michigan Public Health Institute, so people that are in practice, to come into and teach in the program. So we've got both faculty and then we've got practitioners that can help. But it's basically a choose your own adventure with a guide.
I think I get the general idea of it. I don't know why it is like the one thing that's like confusing in my brain. I definitely do get, you know, the general idea of it. But for whatever reason, I was more under the impression that it was almost like another, it was like similar to Apex, where you had to have like a certain amount of like working in a specific field or working with someone in order to create that, like, you know, like.
You do not
Okay.
need to have that external agency, which you do need to have with the applied practice of the Apex. But here's the reason why it gets to be confusing. For some people, they are indeed working on an extension of their applied practice experience because they had such a good experience with that external partner. So I'll give the example. We had a physician who was working with a sort of a healthcare social impact consulting firm called First Quadrant in their applied practice, doing a market scan. In working with that company, that the student realized, oh my gosh, I have been very interested in the impact of opioids on health professionals. And why are health professionals not getting the training in addiction and, you know, both for themselves personally and for the profession? So she just expanded that, and that's what she did for her integrated learning experience, her capstone. So some people are doing that, right? So they are finding a good thing and extending it. Other people are just, you know, peeling off into, like I'll call it a career goal of theirs, or an area that they've always had an interest in but never have had the time to dig in.
All right, no, that definitely helps to understand it better, because like that's where I was kind of getting confused with the crossover, because when I looked at some of the examples, it seemed almost like, I don't want to say contradictory, but it almost seemed like contradictory in my own mind, where I was like, these seem like two totally different things, and I'm not really sure what I'm supposed to be doing.
Yeah.
So thank you so much for clarifying that.
Yeah. I mean, our accrediting body, who has said, oh, everybody's got to do an integrated learning experience, gives us no guidance, except it has to be written. It has to be sort of a substantially written product, and it has to cover at least 3 of the competencies in our foundational MPH and in our program. But that's a little bit, you know, it's almost like pick something from your refrigerator and have it for dinner. It's too vague for most people to envision.
The good thing, Michael, is that you get to take a class that'll walk you through it as well. So Dr. Cardia teaches Pub Health 680 in the fall, which covers your Apex, and just starts the ILE, and then 681 in the winter. That really helps you through it. And so you don't have to be meeting live every single week to get through that class, but you do have some deadlines, some check-in points to help you, you know, hit all of the milestones needed to have the product at the end so that you can graduate. We don't just throw you to the wolves and make you figure it out.
Oh, I didn't think that you would do that. It was just one of those things where it's like, if I don't know exactly what I'm doing, I get a little intimidated. Like, hey, hey, what's going on here? I'm not really sure what I'm supposed to be doing. So yeah, that it just, when I can conceptualize it, it helps me, you know, not be intimidated, so to speak.
Yeah, and we'll give you exemplars from previous years or for what we're exactly looking for. So this is definitely not, this is not rocket science. trust me. Other things?
I'm guessing that's a no. That's okay. Sometimes we just end up having things kind of legacy on. So thank you all so much.
Thanks, Liz.
Sharon, appreciate your time. It was great connecting
good.
with you tonight. Have a good
Alrighty.
rest of your evenings.
Thank you all.
Thank you
Have a
guys.
great night.
Bye.
Bye.